right? It could be the arms, or often it's the chest.
Yeah,
though.
the arms, is it from that part there?
Yes, it's diagonally like here.
So if that part there is tense,
then you think
then it'll be the arms. And
that's correct,
the
especially the little finger. So the little finger side. So the thumb side's going to come more into the chest. So that's why I'm thinking like maybe his thumb could be tight because his chest is so tight.
And what about in this area here, where we always start off?
In this area here, if it's straight up and down, if it's all tight coming up and down through here, which he is a little bit, but not totally, right? Legs.
Would be the legs too as well.
Yeah.
How far up before you go, okay, might be the head?
If he's really tight up here in the base of his neck, coming down into here, and then it sort of gets less tight as you go down, it's probably coming from the head coming down.
What, the intersection of where the arms come in? Above that?
Above that. Yeah, above that.
Below that's in the legs.
Yep.
And if it's on the diagonals, it's in the arms.
Yeah. And if it's tight all through here, it's probably a combination. It means their whole body's probably really tight, you know. And so then it comes down to, okay, where do we start? Well, if the person's really jumpy, you got to start at the head. You may need to start at the head anyway, even if they're not jumpy. You may need to relax them, then get into their body, you know. Okay. So with this, I'm looking at these legs thinking, this is a big job. These legs are tight. There's a big job there. I'm not wanting to tackle this before the front. I want to see what's going on in his front first, because I think his belly and the emotional side of things could be holding some of this tightness too. By me getting rid of the tension on his front, I reckon my job will be a lot easier here. If I look at these legs, I think there's a lot of work here. I'm dreading it right now. I look at it and go, oh my gosh, they're so tight. I would still want to do his feet, but I don't. What I'm wanting to do more right now is just warm them up a little bit, and then I'm going to flip him over. I'm actually going, no, that's way too big a job right now. We'll see when I've done his front. Just remember how tight his legs are now. And also try massaging them and see how easily they loosen up or not. Does it feel like they're going to give easily? No, it doesn't, does it?
So you just got to try and, in your own head, work. Sometimes you might have
As quick as what they could have had you started somewhere else. You could start with his feet. There's no problem with that.
nowhere for it to go, is there?
If he's tight through the front. Well, what I'm saying is that it's going to be a high energy. See, for you, you got the strong hands. You haven't been massaging for a long. Your hands have still got a lot of energy. So you could massage his feet, massage his legs, and that would help. But it may be less painful for him if we started on his front, got rid of the tension on his front. It's going to be a.
This one?
Especially here.
Work it
Yeah, exactly. Yeah. Yeah, easier for me and easier for him. He'll handle it easier.
Brandon, just a question. Do we massage this part here?
Like through the Achilles?
Yeah.
A little bit, but only if we've loosened the foot up. Now, with the calves, see, if we haven't loosened his foot up, this would be really pain. Like, for example, there's like a ball in the middle, in the inner part of the calf muscle. You'll find that on a lot of people. It'll feel like a ball of tension. If you start digging into that without loosening up his feet, that's a very painful thing, and it's not a good pain. You can feel that ball there, can't you? It doesn't feel like it would be good for me just to dig in there, would it? No. Okay, so with calves in particular, don't just dig into them. Generally speaking, a lot of people make that mistake. You must loosen up the feet first. It'll be a bad pain if you just dig into people's calves. Okay? So that's why I say, if I had a lot of energy in my hands, I might go, okay, I could start with this foot. I know that my hands can't deal with that right now. Okay, so I'm going to sit there, but plus I think I want to know maybe I can release a lot on his front without me having to work his feet. Okay, so I'm going to get him to roll over. This is what I'm talking about with strategy. See, this is more how I teach an advanced course. Again, this is strategy, what I'm talking about, the strategy of a massage, to save you a lot of energy and to make it more easy for him to release. We do immediately when he rolls over. To me, what I see is there's a bending of his toes through here, kind of what I call a slight claw foot. Okay, that's quite common. That, to me, shows tension in this part of the foot, which is the reflex area, which I'll talk to you about later, for the lungs. That shows to me his chest is tight, okay, which is also something I've already had a feeling of. So I'm just going to have a quick feel around. I'm not so much treating here. I just want to feel around how tight is his belly. And, of course, how tight is his chest, which is very tight. Does anybody want to have a feel of his belly?
Gentle people.
His tension is very close to the surface, and he responds quite easily to it. So you don't need to go hard.
Where would you like this?
Oh, thanks. I'll put that over here. It's tight.
So, how do you tell the difference between abdomen, like muscle, like muscle?
Abdominal muscle
yeah,
compared to
abdominal
intestinal.
muscle, and like tightness in the belly.
Abdominal muscle is really close to the surface, so his is also abdominal tension.
Yeah.
Okay, so before we get into his intestines, his abdominal muscles need to relax. That's why, like, they're right there. They're just there. You know what I mean?
Yeah.
You know, it's not like, you know, with some, like with you, yes, I was digging in there. You know, my hand was going in about that deep before I was getting to it. Yeah. I'm not touching the table with him. Even though his belly is way bigger than hers, right? So it's right there. That's abdominal tension. Different. That's not intestinal. We got to release that before. So again, with him, he's a big guy. He's definitely taller than me even, and there could be a lot. He's very, very tight. So you see again a lot of work here. But the good thing you notice about him is he does breathe. He lets noise out. Okay, so that's a really good thing. So even though he's really tight, if we can work with that, we could probably use his breath to clean out a lot of tension. And why I say that is because a lot of massage, if you work with a person's breath, it's like they do a lot of the work. Their breath cleans out their tension. Okay, so that's what I'm going to try and work with him. You can see, if I didn't, he would exhaust me. He's a big guy, a lot of work. I'm not full of, I've been whatever on the road for 4 months and teaching for the last, 4 out of 5 weeks. So my hands are a little bit tired. It's not like I'm full of energy, So I need to work on him smartly to conserve what energy I have.
Brandon, the difference in body makeup.
Be wind, air in the belly as well.
Yeah.
You find that once the air goes, it softens, because air makes things hard in the body as well. So releasing that air, that's why sometimes I tend to get air in my belly for some reason. So I burp and pass wind a bit, and then a lot of the tension goes away. So it's not so much like a deeply seated, it's like air hasn't been processed properly. And then sometimes there might be some deeper seated abdominal tightness that needs to be worked on. But with him, it's kind of general all over his body here. It's hard for me to compare because I can't feel my own belly, so I can't compare mine to his. I can feel it, but I don't. It's different working on yourself. Okay, so anyway, right here, I want to start with releasing one leg. Either one, to me, is a fine place to start, whatever. I'm not worried. I want to release one leg and then the other. This is going to be my basic strategy. Release this leg, release that leg. Do a little bit of belly work, do some chest, do some head, neck, come back, do some more belly, do some arm work, maybe a bit more on his legs, probably flip him over to his side, do some side work on either side, do his back, see how he's going. Because he's got general tension everywhere, okay? So it's not like with her where I'm, this specific one side up here, it's affecting the... With him, it's just like everything's tight. Everything's tight, So what I'm doing is kind of almost a bit of a strategy here, but I'm working his front first. It's not a complicated strategy. Even though he's tighter, bigger, it's not a complicated strategy. Simple strategy. I'm going to release his front, do a few things over and over again until a lot of that should let go. Do his sides, do his back, and that'll be good for that treatment. Not to say we'll get rid of all his tension, but it should be good. It's certainly going to help.
So when he was on his stomach,
Yep.
we didn't get into his legs in a big way because we wanted to release his feet first. But now that we flipped him over, we're going to start on his legs. Is that
Mostly on the front of his legs, because I want to get rid of... oftentimes what happens when the belly's really tight like that, it holds the whole body tight as well. So my strategy here is to get rid of a lot of that belly tension, let him be able to relax, and then him relaxing inside himself should take away his own muscle tension a bit. And that's